Hello everyone. Hope everyone is okay today. So today I'd like to make a video on forms used in logistics. I hope you stay with me until the end. We'll go through a question and then we'll be able to discuss forms used in logistics. This video has been made upon request. I've seen a lot of people wanted to know about forms used in logistics. So our stem of the question: you're working from an art clinic as an in-charge and you're expected to generate reports and ensure you have enough stock available all the time. So from the stem, you should know that you are the in-charge. Okay, you are the in-charge and you are working in an art clinic and you are expected to generate reports. Okay, so this should give us a general idea of what we're supposed to do. Okay, so for this question, we have the first part says define a report. B, explain 5 reasons for documentation in the nursing profession. That's 30 marks. Then C, identify 5 logistics management information forms and their purpose that are used in the supply chain management system, 40%. Okay. Then D, outline any 5 key components of ARVs, MLIP, and HIV test commodity system, 25%. Now, for this video, we'll just do the first 3 parts. The last part, I'll make a separate video because it's a bit long on explanation. Yeah, so we'll just do the first 3 parts and just look out for the fourth part of this essay. So our definition of a report, so any oral or written exchange of information shared between caregivers or workers in a number of words. Okay, so in relation to how you can write your definition, you can choose any keywords in that definition, okay, and make your own definition. Then another definition, a systematic presentation of ascertained facts about a specific event or a subject. So any presentation of maybe data from a specific event, okay, that is a report. It can be written or it can be oral. That is my definition. So I don't know how you can think about that. Okay, so what are the reasons for documentation in the nursing profession? So remember, these, you don't really need to remember the explanations that have been written here. If you can remember the heading, you can explain it in your own way. Okay, so to facilitate communication, this helps communication between nurses or between healthcare providers in relation to what has been done on the nurse or what is going to be done on the nurse and all that. Okay, then for continuity of care, so this also is in relation to communication, except that you'll be able to know what has been done on the patient or what has not been done, and then you'll be able to continue care. For example, let's say you're working in a morning shift and then you have other nurses or your colleagues who are coming to work in the afternoon shift. So how are you going to continue care for your clients that are in the ward? They need to know what you have done, and so that you don't repeat, okay, what has already been done. Also, it can also help you in relation to maybe preventing drug errors or drug overload for the patient. Okay, then another reason for documentation, it promotes good nursing care. Okay, so with this, you'll be able to know whether, for example, your treatment is effective or it is not working. Let's say you are giving a patient is on antibiotic treatment, okay, and then you've been giving these antibiotics for the past maybe 5 days, and then you have seen no improvement. What do? You need to know to say maybe the treatment is not effective. You need to change the treatment or go to stronger antibiotics. Okay, all that can be done if you have documented, okay, thereby giving good nursing care. Then another reason for documentation, to meet professional and legal standards. Okay, this is just in relation to the standard of the nursing profession itself. Okay, so here it's all about doing the job, the right job, and making sure that you are doing the right thing all the time, and as you are documenting, your standards are being preserved. Okay, then 5, documentation may act as evidence. Okay, so here in case of maybe a legal proceedings through the courts of law and all that, what you have documented on the patient, in case there were errors or in case maybe the patient died, they'll be able to see or track the documented care that was given to the patient. And then with that, you can even produce evidence, and it can act as evidence on your part as the nurse maybe who was attending to the patient. Okay, so it can help you in the court of law. Okay, so we are continuing with the forms used in logistics, which is the primary purpose for this video. So in relation to logistics and the way the question was phrased, the question was the question had 40 marks, and then you need to explain any five logistics management information system forms that are used in the supply chain management and their purposes. So 40 divided by 5, that's about 8 marks. Then the 8 marks can be split in such a way that 2 marks will be given to the heading, then 6 marks. So when you identify the correct form, they'll give you 2 marks. Then 6 marks for your explanation. Okay, so in your explanation, for you to get the 6 marks, you need to make sure that you explain, for example, the first thing you can explain, let's say you take the store control card. You explain what a store control card in your own, what a store control card is in your own words, in simple terms. Okay, what you understand by what a store control card is, what type of form is it. Then after that, you now write the purposes. When you're writing the purpose, for example, the way they are outlined here, you need to explain each and every one of those maybe activities, for example, with examples. Okay, so what is a store control card? A store control card is a form on which each and every commodity in the storeroom, okay, is entered or is accounted for. For example, let's say you have 500 milligrams of paracetamol tablets, and then you have 250 milligrams paracetamol tablets, and then you have 500 ml paracetamol syrup. Okay, those are 3, it's all paracetamol, but according to supply chain management and logistics system, each of those different strengths of paracetamol needs to be put or accounted for in relation to inventory on a different stock control card. Okay, so this stock control card ensures that each and every commodity in relation to the different types of strengths as well as the different types of drug names and all that have to be accounted for on the stock control card in the storeroom. Okay, so now what do you do with this stock control card? We're saying number 1, it helps you in issuing. So when you are issuing, what is to issue? What is to issue? Issuing is giving out. Okay, so giving out to another facility, for example, or giving out to the ward. Let's say the drugs are being stored in the pharmacy department, and then the pharmacy is dispensing to different wards in the hospital, like maternity, pediatrics, and all that. So when the pharmacist is giving out drugs from the from the pharmacy department to these different wards, that person is issuing out. Okay, so whenever any drug is given out, they need to enter on the store control card as issues. Okay, storing. What is storing? So storing, when you get your drugs, you have bought them maybe from you ordered the drugs from district health office or from Ministry of Health, Commodity Security Center, and then your supplies come to the facility. When you're going to store them in the storeroom, they need to be entered, each and every one of them, on the store control card in relation to the amount, the strength, and all those things. Okay, if there were any expiration, any damages along the way, you enter all those things on the store control card. Okay, then receiving. If you are receiving drugs from, let's say, MSL, Medical Stores Limited, you're receiving drugs from Medical Stores Limited, and then Medical Stores Limited, Commodity Security Center is that Ministry of Health. You're receiving drugs at the hospital. When your drugs reach the hospital, you need to enter them on the store control card. Okay? Then reporting. What is reporting? Let's say you want to give feedback to District Health Office, to Ministry of Health, Medical Stores Limited, Commodity Security Center, about maybe the supply chain process and all that. The quantities received, if there were any damages along the way, or whatever has been happening to the entire supply chain, if there are bottlenecks and all that. So you need to get the information of in relation to the commodities received, okay, from the stock control card, because you've been entering those on a daily basis or on a monthly basis. Then ordering, if you want to order a specific drug in relation to the amount that you want, or if you want to place an emergency order and all that, you need to get that information from the stock control card, because the stock control card will tell you to say maybe there are 500 bottles of paracetamol left, something like that. Okay, if you are doing a physical count or physical inventory where you go in the stock control card, maybe you want to review how much commodities you have before you place an order. You want to just count. Okay, after you count, you do your physical count or your physical inventory, you put the total number of whatever commodity on the store control card. So whenever you're doing a physical count, you enter that information on the store control card. Okay, then daily activity register. So the daily activity register can be for ARV drugs, for HIV test kits, for laboratory supplies, or for essential medicines. So this daily activity register, like the word says, daily activity, it means that it records, okay, and tracks the number of drugs that are dispensed to patients on a daily basis. So literally every day, each and every patient that comes and you are giving, for example, ARV drugs, you enter each and every of those quantities of the different strengths on the daily activity register. If you are testing clients, each and every test, whether it has worked, whether it has expired, whether it is invalid, whether it didn't work, okay, or whether it was damaged, you enter each and every one of those test kits that you use on the clients, whether you use them or not, on the daily activity register, and put the totals of whatever you have used. Okay, so now what are the activities for dispensing? So you're dispensing drugs on a daily basis, you enter all those on the daily activity register. You are reporting how many drugs were used, how many drugs were not used, how many drugs expired, how many drugs are remaining. You are reporting, you use the information from the daily activity register. If you want to order essential drugs, ARV drugs, HIV test kits, you can use the daily activity register to order, because you know how much you are using on a daily basis, how much the hospital or the health center is consuming in relation to the consumption data from the daily activity register. Okay, Then reports and requisition form. Okay, reports and requisition form. So the third form as well, it can also be for any of those 4 commodities in relation to the logistics system. So it can be for antiretroviral drugs, it can be for essential medicines, it can be for HIV test kits and all that, because you are reporting and you are requesting. So to provide logistics data to MSL CSC. So MSL stands for Medical Stores Limited Commodity Security Center, that is CSC. Now this place is at headquarters, that Ministry of Health in Lusaka. Okay, so it is at the main warehouse, the central warehouse at the main branch. So it provides a report on the stock status of commodities at the facility. Okay, so this one, you want to report back to MSL in relation to the stock status that you have at the facility, whether it is ARV drugs, HIV test kits, essential medicines, and all that. So this, you'll be able to report, give reports. This form is important when it comes to the pipeline. Okay, I'll try and make a video on the pipeline as well. I'll post it so you'll be able to understand this form, where you report back in relation to how the commodities are being used, or how they are reaching, if there are any bottlenecks, if there were any spillages, any damages along the way, and all that. Okay, then it also helps you to order commodities. So it helps you to order the drugs, because you are also entering in relation to the quantities that you have received from MSL and all that. So it can also help you in relation to orders that you want to place. Okay, other forms, we have a supply voucher. So supply voucher for ARV drugs, health centers, for health centers that store drugs at the district. Okay, so if you are working from the health center, okay, it can be rural health center, urban health center, and all that. You're working from a health center, you can use a supply voucher. Okay, not those people who are working from the hospital. So if you're working from a health center, you can use the supply voucher. Now, what is it used for? 1, to request commodities from the district. Okay, to request drugs. So you can use it to request, for example, essential drugs, ARV drugs, and all those. Then to account for receipts of products from the district. Okay, then also to note any discrepancies. So if you are requesting, okay, you are requesting supplies from the district, okay, that is in the pool system, you are requesting supplies from the district or drugs from the district, you can use a supply voucher for ordering. Okay, if you are you also want to account for anything received from the district. So you have received drugs, for example, and you want to know if those drugs maybe have reached your center or not. You can use a supply voucher to see if those commodities have reached your facility. Then to note any discrepancies. No, so this one, in relation to discrepancies, for example, let's say you are expecting an order to come in the first week of every month, and then this month of May, the commodities have not reached, but you had placed an order. Because of that, you can check on a supply voucher. Okay, so activity for ordering, you want to order from the district, you can use the supply voucher. You are issuing, okay, either issuing out to the district, maybe because of damages and all that, you can use the supply voucher. Receiving from the district, you receive orders that you already placed, you can enter those on the supply voucher to note that you have been allocated the resources. Okay, so daily activity register, we already looked at it. Now this one is for HIV test kits. Okay, so like I said for the other one, it is almost the same with this one. So this one you are using it on a daily basis. So to track the number of tests used to test the client, this is on a daily basis. So whether those tests have been found invalid, whether they are accurate, whether there were some damages, you enter each and every one of those on the daily activity register and account for each and every one of those. Okay, then to record the number of tests used by purpose on the test, by purpose of the test. Okay, so whatever purpose of the test, you enter it. Then to record stock balances of the HIV testing sites within health facility. So this one, let's say you have different testing sites, like for example, you have the first testing site is in outpatient department, the other testing sites in maternity, the other testing site in let's say in the general ward. Okay, then the other testing site maybe in pediatric ward and all that. So those different testing sites, you account for whatever test that has been made in those different sites on a daily basis on the daily activity register. Okay, so this one is used for testing clients. Every client you test, you enter that information and how many test kits you have used in the daily activity register. You are reporting in relation to how many you have used for that day for that site. You can use the daily activity register because it accounts for each and every test that you have done. Then for ordering, because you know the amount that I've used, you'll be able to order in relation to whatever you have written on the daily activity register. Okay, then MSL dispatch note. So MSL dispatch note to account for receipts of products from MSL at the district or hospital. Okay, so this dispatch note, Medical Stores Limited dispatch note, we're saying if you're working from the district or if you are working at a hospital and you are receiving from MSL CSC, okay, from the main branch, the main Ministry of Health, whenever you receive drugs or commodities at the district or at the hospital, because they send their orders directly to Ministry of Health, whenever they receive, okay, to account for whatever product that they have received, they will enter that on their dispatch note. Okay, so this will be used for receiving any commodity, whatever commodity you have received, you enter that information on the dispatch note. That is if you are working from the district or the hospital. Then if you are issuing, let's say whenever the products reached your facility, you found some damages, you don't just keep them because that will make you to have a shortfall. So what do? You take them back so that they give you or a surplus or a replacement for whatever you have whatever was damaged. So you can also use the dispatch note. So this is the part where it says issuing. So if you're issuing back to district, okay, then another form is an internal monthly summary report form. Okay, so again, this internal monthly summary report, it can be for any of the four what are they called again? Any of the four logistics management commodities that are supported by the supply chain and logistics management system. So you can use this. What is the purpose of the internal monthly summary report? To report aggregated data or information from different sites per month. So when there are multiple testing sites or multiple sites in the facility to be reported on a monthly basis, so report and requisition can be used. Okay, so if you have any reports and requisition for the different sites, so for example, like I said, you have got, let's say, maternity wing, you have OPD, you have the general ward, you have the laboratory site, the actual laboratory. So let's say you are testing clients in these 4 different sites. The lab, you go to maternity, you go to OPD, you go to the general ward, the medical surgical ward, or whatever ward, or even pediatric ward. Okay, now every day that you are testing these clients, you need to account for all those test kits that have been used at the end of the month. Okay, then if you want to order, okay, as a facility for the entire facility, you need to get the aggregated data from all these 4 sites, account for them, okay, at the end of the month. Then when you have the total number, then you can use it for ordering. Okay, then you can also use it for reporting, because it will help you summarize how much you are consuming as a hospital, as a health center, at the end of the month from the different sites in relation to the commodities used for that time period. Okay, so you will know to say, okay, we have used about maybe 1,000 test kits, so we'll be able to order 1,000, or you say 1,500 or whatever. So with that data, you'll be able to know, you'll be able to use the information for reporting. Okay, you can also use that information for ordering. Okay, I hope it has helped. Thank you very much. Thank you. I hope you'll be able to subscribe and share this video to others. Thank you so much.